Hello, I'm Dr. Audrey Klenke with Pinnacle Plastic Surgery and Bluffton Dermatology. Today we're going to talk about confocal microscopy. So confocal microscopy is the latest technology in skin health. It's a way to find out if a skin lesion or a concerning mole is really worrisome or it turns out to be nothing. The way it works is you come into the office, and normally we suggest doing a full body look over to make sure you don't have concerning lesions where you can't see them. And then we can use this technology on virtually any lesion on almost anywhere on the body. So you would come in and we would get you in position on a nice comfortable table, and each lesion is imaged separately. Takes about 8 to 10 minutes per spot. We put a little bit of this ultrasound gel on your skin, and then this arm moves, so it will move around, and we place it directly on your spot that's concerning. And it really just sort of sits there and touches you. There's no heat, there's no pain, there's no numbing medicine. And while you're sitting there, you actually also get to watch your skin lesion on the screen. So we're going to image it in different layers. Those images then get sent via Bluetooth to the pathologist who reads them. So there is no actual slide, which means the turnaround time is much quicker. We're talking a couple days, and we'll know whether you need to be worried or not. So a lot of our patients ask, what's the difference between confocal microscopy and a traditional biopsy? Because many of our patients have had traditional biopsies. There are some lesions that still probably should be biopsied, and that's really up to your provider to decide. But for those people who are great candidates for confocal microscopy, the benefits are that, again, it's totally painless, so there are no needles, there's no numbing, and it's quick, so it takes about 8 to 10 minutes per spot total, and then you have your answer within 2 days. The other great thing is that there is no wound, so there's no area that has to heal, that you have to treat with a Band-Aid and ointment, and there's going to be no scar. So patients love that. It also gives us a way to track that lesion over time. So once we have an image of that lesion, let's say it changes 2 years down the road, we can confocal it again and compare it to the images from a couple years ago. It's also great for children. Children do not like needles, they don't like pain, and parents don't either. So if your kid has a brown spot or something that's just changed over time or is concerning to you or their pediatrician, kids do great with this technology because, again, it doesn't hurt, and they get to sit there and watch the images. They love it. They think it's pretty cool. Confocal microscopy is relatively new to our area. It's not new to the world, so this is a very commonplace technology that's used in Europe. The problem is that in the United States, many of our dermatopathologists, or the folks who read these images, have not been trained properly yet to read these images. So there's only a handful of people in the country who can actually tell you what the images mean. So as that continues to grow, it will become more popular. From a cost standpoint, again, new technologies are often very costly. So as time goes on, these are going to become more and more readily available to practices all over the country. But for now, we are the only practice in South Carolina that has this opportunity, and I'm so excited because I think it's going to be totally game-changing for many of our patients. In my area of South Carolina, sun and fun go hand in hand. Patients and people in general move here to be outside and enjoy themselves, so it makes it even more important to undergo annual, at least, skin checks. Some people who've had a history of skin cancers and concerning lesions, especially melanoma, really need to have skin checks more frequently than that. And it really doesn't matter your age. I have young patients come in who have bad things, even melanomas, and we have older patients who, again, just are getting that annual maintenance to try to prevent things from becoming larger too quickly so that we can take care of them more easily. So it's critical that you come in and be seen. Confocal technology is really meant to categorize a lesion into concerning and maybe needs an actual biopsy or needs to be completely removed. It has some features of both, and you can either watch it or biopsy it, or this is completely benign and you should leave it alone and just monitor it clinically or with additional confocal images in the future. So it really allows us to sort of categorize a lesion into one of those 3 spots and then decide what to do about it. So the really nice thing is when it turns out to really be nothing, and sometimes patients or parents can breathe a sigh of relief and we don't necessarily need to do anything at all. With the confocal microscopy, again, as you're categorizing a lesion into levels of scary, this is very scary or this is maybe not so scary, some of the things it allows me to do is if we determine that this is very concerning for a melanoma, is to sort of skip over the biopsy stage and to go ahead and excise it. So it gives that patient the peace of mind a little more quickly, the lesion is gone more quickly, and we can all sort of move on and breathe a sigh of relief. And again, sometimes if it falls into this is really nothing to worry about category, laboratory, it allows us to track it over time and again, continue to reassure the patient in the future with repeat imaging that this is not concerning. So sometimes it does help us avoid procedures, and sometimes it helps us fast track to a procedure so that the patient doesn't have to wait. So each skin lesion takes approximately 8 to 10 minutes to image, and it really depends sometimes on the size of the lesion. So one of the other major benefits to this technology is that you don't have what's called sampling errors. With traditional biopsies, when you're taking sometimes a small piece of a lesion, there can be other areas of that spot that actually were doing something more mischievous than the spot that you sampled. That's called a sampling error. So if you have melanoma and we think it's this certain depth, but then you go and remove the whole thing and it turns out it actually went deeper in a different area, sampling error is a real thing. With confocal microscopy, there is no sampling error because you're seeing the entire lesion all the way around and all the way down. And then I'd say the other really great benefit is that you get results so quickly. So these images get uploaded via a patient-protected Bluetooth technology. So your dermatopathologist can read this anywhere. So if he happens to be on the beach somewhere enjoying his family time, he can actually pull up your images and read it right there. So within 48 hours, we have a result and we know what's going on. Confocal microscopy is definitely the latest and greatest in skin health technology. Many of our patients ask, what's next? Is the robot going to remove my skin lesion? I don't think we're there yet, but I do think maybe the next step in technology is going to be the ability to use something like confocal imaging while you're doing a procedure. So being able to remove a spot, close it, and then use the confocal to tell you that it's gone in real time. I think that's probably our next step, and I'd love to try that. Our goal here at Pinnacle Medical Group is to provide a premier resource for our local community to optimize skin and global health.